Well, hello, and welcome to this edition to the Mayor's Emergency Response Roundtable. I'm Rick West, Mayor of Chesapeake. We're in our 6th month of this epidemic, and we've been fighting and doing a lot of different things for these last 6 months than we've ever done before. Today, we're here to talk about one of the hottest issues throughout this country, and particularly in every locality, Chesapeake and every other locality, and that's the opening of schools. It is fortunate that we have this topic to talk about today because it'll be our opportunity here in Chesapeake to know the facts in Chesapeake. Not what newspaper reporters write, not what people are rumoring, not what the politicians at the state and federal level are talking about. We're here today to talk about Chesapeake and Chesapeake's decision in terms of opening schools. I am so happy to have my former colleague and my friend and a great leader of our school system, Dr. Jared Cotton, here with us today to talk about some of the issues and to answer some of the questions that are out there regarding their most recent decision. Dr. Cotton, welcome.
Thank you. Happy to be here.
Great. So let me just start by, we're going to have some informal questions just kind of come up. I'm going to give you an opportunity to just give what you want to say at first, and then we'll go from there.
Sure. Thank you. As you all know, this has been a very challenging time for all of us as we prepare for the upcoming school year. We've said this many times, and we'll say this again, we've never done this before. So this is new to all of us as we move forward. But I also want to make sure that people understand we're not being cavalier about the decisions that we make. We have a school health advisory team, which includes Dr. Welch, our Department of Health here, a local director, who's very much involved in advising us on decisions that we make moving forward. And that committee has lots of health professionals as well as school-based staff and community members who help us make important decisions as we move forward. And I know that this is one of those things that changes all the time. It's something we have to monitor very closely, and we have to monitor the metrics very closely, which I know we'll get into a little bit today. But ultimately, we're keeping our focus on our mission and our purpose. And our purpose is to serve our students and to make sure that we support our students and families, and we help our students learn and grow. And we also know that not all of our students can learn effectively virtually. There are certain things that you can't do effectively online, and there are also student groups and particular students who have to have hands-on, in-person instruction. So we know that our goal has to be to get our students online or in person as quickly and safely as possible. So we're going to keep moving toward that purpose. And I apologize in advance because we present something that we think will happen, and then we have to tweak it and change it as we go along. But we're always going to provide ample notice for our families so that they have time to adjust.
And that's one of the things that I want to comment before I ask you the next question. Ever since you've been at one of these roundtables, you have constantly said, well, this is our plan for the day based on what we know today. Now, that may be a little disconcerting to people because those decisions do change, but we should all feel very grateful that you're looking at the facts, you're looking at the metrics, you're looking at the total picture. And unfortunately, when you look out there, it's like any other issue. If you make a decision, half the people are going to be angry and the other half are going to be happy. So whatever way you go, it's sort of like, I think I mentioned before, I served under 4 school superintendents, and they all said the most difficult decision was whether they're going to open or close for 1 or 2 or 3 days for snow. Now you're looking at, I don't think Virginia schools have been closed since the 1950s. This is the first time that something of this magnitude has ever occurred. So you are dealing with an issue, like you said, we've never been here before. And I respect the fact that you are not dogmatic about one way or the other. You are trying to address the issues of different, who comes to school, who learns virtually, when they come. And so tell us about that. What's the plan?
Well, in the summer, we did give our parents and families an option to do the on-campus continuum or the online. And the on-campus continuum really had 3 different scenarios, and that would all be based on our COVID-19 rates in the eastern region. And by the way, we're looking at the whole eastern region, not just Chesapeake, and we're looking at more than one metric. We're looking at 2 key metrics, and I know that one particular metric has gotten a lot of attention lately, but we do look at the whole region because we share staff across the region, and we wanted to make sure that we had more of a comprehensive approach as we move forward. So our families had those 2 options. They were able to select from whether in person, whatever that looks like, whether it's blended or 5 days a week. And then we had families who had the choice to choose 100% online. And we asked our families to commit to a whole semester at least for the 100% online for the first semester. And the reason that's important is because we have to plan out our staffing and our resources. And the fortunate thing that has occurred is as we've gotten hard numbers, with families that have selected either option, roughly 60% of our families selected the on-campus option. And especially when we're looking at our high-need student groups, like our special education students, our English language learners, and our early learners, our primary students, our pre-K through 3rd grade in particular, we were able to determine that we could space our students out in our school buildings, and instead of doing the blended, now keep in mind the whole reason for the blended option was so that we would only bring half of the on-campus students in at a time, and that was really based on numbers. But now that we have exact numbers of students and families who selected the in-person option, and we've done assessments of our buildings, we felt we could bring the students back 5 days a week because we have ample space to spread them out throughout the building so that we could create physical distancing for our students. So that's where we got to that point. Plus, we also understand that what a nightmare it is for our families to do a 2-day-a-week schedule, 3 days at home, 2 days at school, and all that's involved in that. Of course, that wasn't the primary reason for us looking at the 5 days seriously, but we felt like if we could make 5 days happen, we had to really try to do that because we also know it's important for our students to have that time in person to receive instruction.
So if I may ask you about the survey. I have heard some say they thought it was a survey just to know what would you do and didn't think it was something they were committed to. What are they committed? Are there changes? Is there any flexibility in terms of how they responded then and how they might feel today?
Well, we really need those numbers in order to plan, and our decisions moving forward are really based on those numbers. We have told our online families that if you selected 100% online, then you need to at least commit to the semester. Some school districts have said you need to commit to the entire year, but we understood that we at least wanted them to commit to the first semester so that we'd have time to make adjustments for second semester if we had families who wanted to move. We do anticipate that there will be families who now say, you know what, I'd prefer a change. We'll look at it on a case-by-case basis, but I have to be clear, we cannot honor all of those changes. If we honor all of those requests, then that will cause us to not be able to move forward with our plan, and it will cause us to have to look at different scenarios. So we really needed commitments from our families, and if you remember in the summer, we extended that decision for our families to have more time to make those selections. Of course, as you might imagine, I'm hearing from a small number of families already who have said, now that you've made some changes, now we want to make a change. And we'll look at those on a case-by-case basis, but I don't want to paint a picture that we're going to be able to honor all of those, because if we honor all of those, we frankly don't have the staff and resources. I'm talking about teaching and staff in the buildings, but we also have to consider transportation, we have to consider school nutrition. I mean, there are all these moving parts, and if our number continues to change, we're never going to be able to move forward with providing the instruction on campus.
I'm not sure that there's a lot of circumstances that would make parents want to change too dramatically anyway. I think that from what I hear, there's probably 60% still that want their kids to come. And so you may have the other, and maybe if there's openings, if a few people decide they don't want to do the actual attendance, you may be able to create some spots. Is that correct?
Yes, that's correct. And now, and again, I've only heard from a small number in the past couple of days, and I hate to say that because now I'll probably get 300, but I will say that we have some parents have said now that we're not doing the temperature checks. You know, we had a discussion about temperature checks, and I want to make it clear that was not a frivolous decision that we made, and I know that some of our families are concerned that we are not putting in the necessary mitigation strategies for them to feel comfortable with their children coming back to school. And some people feel like we made that decision, you know, out of convenience, and that's not the case. We actually had our school health advisory team advise us not to do universal temperature checks. You remember initially we were going to check every child's temperature as they came into the building. Mm-hmm. And what the CDC has said recently, as well as the American Association of Pediatrics, has come out and said the universal temperature checks is not necessary or helpful because you literally are going to have lines of students waiting to have temperature checks. You're going to have them congregating, or you're going to have them go back to the classroom and then go around and check, and they're already in the building and already interacting with their peers, not to mention the fact that they've already ridden the bus to get to school.
So the very thing you're trying to prevent, you're causing, right?
Exactly. So all of these things are happening, and we certainly can't have a bus driver check temperatures but before they get on the bus, because then they'll get to school at noon. But we were trying to make sure that we had all of these, but we were willing to do all of that. But again, we base it on, we don't make these decisions in a vacuum. When the CDC and the American Association of Pediatrics and our health department tells us, have the parents do symptom checks before the students come to school, which we're going to require, and we talked about that. All the teachers have to do symptom checks, and that's recorded every morning. We have handheld thermometers for any staff member or student who needs to do that to make sure they're okay. All visitors will have to go through a screening process. I visited a school today, Greenbrier Intermediate, and I walked in, checked my temperature before I entered the building. All of those strategies are in place, and I don't want anybody to think that we are relaxing those strategies. We're just using recommendations from various sources, and I'm not the health professional, so I have to rely on advice from others.
Of course, and I appreciate that, and I'm sure everyone else does too. And it's interesting that you should talk about that. I actually attended a meeting a couple of weeks ago, and this company is going to be meeting with our manager later this week, I believe, who say that the temperature check can be the way they're doing it, it's so environmentally influenced, it can give you so many wrong interpretations. And so they've invented this kiosk, or not invented, they've created this technology for a kiosk where you can look into the kiosk and it determines by your tear ducts whether you are actually have a fever or not. And I believe they said they can get 250 people through that in 15 minutes, which may be something to be looking at in the future. But I thought it was very interesting that, again, the thing that you think is giving you protection may give you false information and cause the opposite thing to occur. So what about the teachers? Are all teachers coming back at the same time, and what precautions are we taking for teachers?
Yes, we have really been thinking thoughtfully about our teachers returning to school. We have our teachers, actually our returning teachers came back last week, Thursday and Friday. Our brand new teachers came back, came back on Monday. Really, much of what happened last week was virtual. We let our returning teachers either attend in person or virtually Thursday and Friday of last week. But over the next 2 weeks, we're asking our teachers to come in at least 2 days over this week and next week in order to start setting up their classroom and to start preparing their learning spaces. Starting September 14th, we're asking our teachers to attend in person every day, 5 days a week. And this is for the on-campus teachers. These are the teachers who are providing who will eventually provide on-campus learning. And the reason for this is we wanted our teachers to prepare the classrooms, practice those safety guidelines, those mitigation strategies. You don't want to bring teachers into school when students are coming into school for the first time. Our teachers and staff really need to prepare to welcome our students back, and we felt that was important. They also need to spend time arranging their classrooms, raising concerns or issues of anything that needs to be addressed prior to student return. And we felt strongly that in order to get our students ready to come back, we have to have our teachers in our building. Now, our teachers who are providing the 100% online, we're letting them work from home. And I have had some of those teachers say, well, can I come in and work in the building? And really, we look at that at a case-by-case basis, but we really need the space. And as I said earlier, we're going to need every nook and cranny in the building to spread our students out to create physical distancing. So we have told our 100% online teachers that they can work from home, and we have many more teachers doing the online than we initially anticipated because we've had such a large number. I would say around 39% or so of our families want to do online across the district. But I have to tell you, in some of our communities, that number's higher. We have some schools with as many as 50% of the families that want to have their child learn online for the first semester. So you really have a mixed bag.
You really have made an effort to give people what they want, and to the best that you can determine what they want. So by providing the online and providing the on-campus, so it's just amazing. Now, I understand a lot of work has been done on your online instruction. Do you want to talk about that?
Sure. We have been telling our community and our parents that online learning is going to look very different than it did in March. Now, I want to just tell you, and just to put in a plug for our teachers and our administrators, our teachers are incredible in Chesapeake Public Schools. I know that you know that. They knocked it out of the park, as I told you, in the spring. I want to make sure that everyone understands that when that happened, we were in reactionary mode. Literally, we found out that afternoon that schools were closing for 2 weeks. I found out from a phone call from a parent that we were closing. And then, of course, soon after that, we were told we're closed for the rest of the year. So everything that we pulled together, we did virtually, and we had to do a lot on the fly. But now we've had the summer to prepare for what's coming. We have a new learning management system called Schoology that we've been working to put in place. We've been working on virtual schedules. Of course, we have a new theme now. It's called Virtually Unstoppable, because our teachers are virtually unstoppable. We're ready to meet the needs of our students and families, and it's going to be much more hands-on, a lot easier for our students to submit work, a lot easier to provide all kinds of resources to our students for their learning experience. And of course, we built in office hours and opportunities for teachers to connect with students. So right now, all of our students are going to be online for the first week or so of school initially. So all of them are following a similar online schedule, and the schools have been getting all of those out to their families. But of course, as you heard, we're going to slowly start bringing back our most vulnerable populations and our high-need student groups. We're going to start by bringing back our students who receive related services. And I know you know, your former principal, these are students who receive physical therapy, occupational therapy, maybe some intensive speech therapy. You really can't do those virtually, so we need to bring those students into the building. And that's on the 14th of September, which is the second week of school. And then we're looking at bringing back our special education students who receive 90% of their services self-contained, because that's an important group. And our English language learners will come back. Actually, they're coming back, I believe, on the 14th as well. But and those are our neediest English learners. These are students who are learning English for the first time, so they need a lot of additional support. And of course, we're bringing back our pre-K, our students, and our kindergarten students, hopefully as early as the 21st of September is our current plan. And then the following week, the end of the month, we're hoping to bring back grades 1 through 3. Again, these are our youngest learners, and we feel like they need the in-person option. The virtual learning will work in the short term, but it's not a great option, especially if some of these students don't have someone at home who's able to spend the time. And we have families who they would love to be home and work with their children, but they have to work themselves. So we've had to we really worry about those kinds of things, childcare and all of those issues. So a lot of moving parts, but we feel like the plan that we have in place is a good one, and of course now we have to work hard to implement.
You know, I think one of the things that makes you successful as a superintendent is what you just said is you understand the values that teachers bring to the whole process. All decisions can't be made from the central office to solve problems. I know for me, my first principalship in an elementary school, it wasn't by choice. It's just I didn't have any idea what I was doing, so I had to rely on the teachers. And it was probably one of my best experiences as a principal because teachers sort of told me what the best way to do things were. And the fact that you're bringing them back earlier, they will discover ways to arrange those classrooms where those kids will be safe. They'll probably bring up things that you or none of your staff could even thought about. They'll not only tell you, they'll have the solutions for them. So I'm with you. I have a great deal of faith in our teachers, and I know you do, and I think that's what makes our school system so great. Back to the online thing, I wanted to ask you, are we at this point certain that everyone that needs a Chromebook or needs technology to receive their home instruction and so forth have what they need, and if they don't, they can get it, and if not, how?
Yes, I just visited some schools this morning and saw them distributing the Chromebooks to students and families curbside. So our initial focus has been to provide all of our families with the devices they need, the Chromebook, as well as internet. Of course, we did a parent view verification, that's our online parent system, where we asked our parents which option they would prefer, but regardless of the option they selected, we asked them, do you need devices for your children? Do you need a Chromebook? And do you need internet in your home? So we had our parents let us know whether they had that need, and that's our priority. So over the last couple of weeks, we've been distributing Chromebooks to families who indicated they had a need, and we're also distributing hotspots. We purchased over 2,000 hotspots for our families, which we think more than will fulfill the need. But we also had our Education Foundation who sponsored an additional 400 hotspots that we were able to provide as well. The other good news, and I know you know this because City Council has been very supportive of providing CARES funds for us, we're moving towards one-to-one. And I've said many times, and I know you've heard me say this, we had a 3-year plan. Now it's a 3-week plan. But we're trying to get one-to-one devices into the hands of every one of our students. And with the support of City Council, as I said, we are going to eventually have one-to-one devices for grades 6 through 12. And then I'm hoping we're going to add grades 4 and 5. And if we get grades 4 and 5, then we think we'll have enough devices to get one-to-one across the board. One of our great local churches, the Mount, and Bishop Kim Brown helped us with our preschool students, providing $30,000 to support giving every preschool student a tablet, which we are excited about. So our hope is that all of our students will have a device. That will probably happen a little bit later in September, so that's our secondary focus. And the other issue is there's a supply chain issue. Everyone in the world is trying to get their hands on Chromebooks right now. So the orders have been delayed, even though we ordered back in May. We're still waiting for our Chromebooks to come in. But my commitment is making sure that every family that has expressed a need, we will provide either internet or a device. We have had families that say, you know what, I'd like a device now, but again, that's our secondary focus. Our number one focus right now is to make sure every family has what they need to start virtual learning.
All right. So, you know, they said there's a silver lining behind all of this, right? And I know you came to Chesapeake with technology as one of your number one goals. So this is, in a sense, speeding that whole plan up, correct?
It sure is. Yeah. And I would also say that I was without a technology director during most of last year, but I'm excited that I have an outstanding technology director in place, and we've done a lot in a short amount of time.
Great. Is there anything I haven't asked you about that you want to address or talk about, any questions or things that have been coming up that we haven't yet hit on?
Well, just back to decisions we make about bringing students back to school. I know that we continue to get questions about the metrics and Chesapeake in particular, and why the positivity rate is so high and things like that. And I can't speak to the positivity rate. That's more of a Dr. Welch conversation, and as well as the health department. But I just want our community to know that we have two metrics that we're monitoring, and we're monitoring the eastern region, as I said earlier, not just Chesapeake. And we have a consistent downward trend over the last several weeks, which is what we've been looking for. And we hope that that downward trend will continue. But I also want everyone...
A downward
trend.
A downward trend of positivity or?
Positivity and the case incidence, both of those metrics
Cases. Okay.
have been trending downward. And by the way, on our website, we do provide a health metric update for our families if they want to go and see how they are moving downward. Right now, those metrics are both in the moderate area. They were in the high range when we talked to the board back in July, which is why we recommended the online. But I also want our community to know that we don't make any of these decisions without guidance, advice from our health department and our school health advisory team, which I talked about earlier. And if we have any concerns, or if the health department or if that advisory group has any concerns about bringing anybody into the building, then we will not bring anybody into the building, I assure you. Even with our teachers, and I did several employee webinars and forums with our teachers over the last few weeks, and I said if at any point I'm concerned about their safety, or I have an indication that their safety is at risk, then no one's coming to school. You know, we're not going to bring students, we're not going to bring teachers into the building. But I will tell you that as I've visited schools, our teachers are excited. You understand they were nervous, as we all were when we came back to work and came back to our workspaces. But our teachers are excited because they know how important they are and the important role they play in the education of our youth and our great communities. So I just want the public to know that if you could see what I see when I walk around and visit and I Zoom, because I'm doing a lot of Zooming these days. I don't see a lot of people in person, but our teachers are very positive. They're excited. They're apprehensive. They're nervous, as we all are, but they understand how important their role is. And I will tell you, they're gonna knock it out of the park. They're going to serve our students and community well, and they're the best. And I will say that, and I know you know that because you're a former administrator at Chesapeake, and I know you know a lot of teachers. But I'm so proud of our staff and our administrators, and they're a little apprehensive right now. But I keep telling them a lot has changed, but there are things that have not changed, and that's how we care about our students and the relationships we form with our students and what we do best. And we're ready to do that starting September 8th. School starts September 8th. That's our first day of learning, and we're ready.
I have to tell you, when I was coming in here today, and I rode by Greenbrier Christian, and I saw that 25-mile-an-hour lights going on, a little excitement, and I'm looking forward to seeing that little. I used to be annoyed by it, quite honestly, but it's going to be quite interesting and good for people to see that. And I just appreciate you for, one, being bold and courageous to make decisions based on the facts. Of course, no one has a crystal ball, and I think I've heard you say, if we find that things aren't working as we anticipate, we can always take a step back. You're remaining flexible to move forward. I know you're anxious. I know our teachers are anxious. I know our parents are anxious to see us get back to normal. And so again, I thank you, the school board, your administrative team, and all the teachers that are out there for what you're doing, Dr. Cotton. Thank you.
Thank you very much. I appreciate this opportunity, and I would like to also say that we're here to answer any questions. We answer our questions as quickly as we can, and we have lots of great resources on our webpage that are available to our community, so let us know.
And so before we end, let me just simply make a plea to all of our folks. I know that a lot of people are reading that positivity rate of Chesapeake over some of the other, or all of the other cities here in Hampton Roads. And, you know, whether that rate is accurate or not, I don't know. As Dr. Cotton said, this is not my area of expertise. But I do know that it is important that we obey the mask, the distancing, the hand washing, all the things that, as Dr. Welch has told us time and time here, that we are in control of how well we deal with this pandemic, and it's up to us as citizens. I will tell you, I asked her last night exactly where are we getting the high positivity rates, and we are getting them into more dense areas of our city, such as South Norfolk and in Greenbrier and in Deep Creek. The less dense areas are not. So, and we're getting a lot of positive rates or infections from family and social gatherings. It seems that we all want, Chesapeake is a family-oriented city, obviously, and it's okay, that's good, we need to be, but when you bring in family members that are not part of your household, you still need to observe those 6 feet or wear the mask and be protective. We're going to get through this. We're going to get through it together. We're going to be stronger. We're going to be better. Dr. Cotton, thanks once again, and I say goodbye.